So I think we're going to move on to questions from the audience, if that's okay with you.
Sure.
So we have a question that says, my uncle has been coughing for months and he gets out of breath even when walking short distances. He used to smoke, but he quit a few years ago. Could this be COPD? Should we get him tested?
Is it possible that Mr. Kash's uncle has COPD? Absolutely. The reason is that I tend to explain lung disease as a burden that you're carrying. Let's say you're smoking every day, your lung function is going down. Think of it like a bag and you're putting rocks inside that bag. When you're 45, you've been smoking for 25 years, you don't feel much of symptoms because you're strong, you're healthy, you're able to push through and carry those bag of rocks in you. But when you continue to smoke, you're adding more rocks, which means you're carrying more of a burden. And when your strength that is needed to perform activities is less than the strength you have to carry that burden of lung disease, that lung limitation, that is when you start noticing symptoms. Even though his uncle quit a few years ago, does it mean he does not have COPD? It's likely that the COPD has not gotten worse in the last few years. It is possible that he may have mild COPD, and in the last few years, because his age has gotten bigger and his strength may have gone down, um, it may be more significant physiologically. Does that make sense? So he may have COPD. A few years ago, he may have had the strength to push past it, but now he may not. So I would definitely advise getting a pulmonary function test and seeing a lung doctor.